Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education. We're back in the studio, had a week off.
We're back. We're talking about bio-remodeling, bio-stimulating, I'm confused by all this bio stuff. We need some clarity, Jake.
That's what this masterclass is all about.
Yes.
So welcome to chapter 3 of our masterclass series. And we are delighted to host my friend all the way from the UK, Dr. Beatriz Molina. How are you today, Beatriz?
Hi, good morning from UK. Very well. Thank you very much. I think it's evening for you guys over there.
It is.
It is evening time. So in these masterclass series episodes, guys, if you're new to this, we delve into products. Today, we're talking all about, the theory of bio-remodeling and the product called Profilo. And we might even talk about the new one coming called Structura at the end. But we tried to get into the nitty gritty, get you guys listening to understand the why, the how, and it gets a little bit more technical. So don't worry, David. We'll look after you. We'll get some business in there as well.
We'll get some business. I want to know a little bit more about Beatriz and her background, because I detected an accent. I hear it's Spanish, but you ended up in the UK.
Yes.
So maybe before we get into all the sciencey, nerdy stuff, let's find out a little bit about you and your background, how you ended up in the UK, because I know you got a background in GP as well. How did you end up in aesthetics?
I got a very mixed background, you're right. So I did my medical school in Malaga, which, as you can imagine, beautiful sunshine, great weather. It was a beautiful city. But I decided while I was preparing for the exam you have to do in Spain to learn English and have a little bit of a sabbatical, and came 6 months to the UK. Of course, love gets in the way. Fell in love, married my husband, who is obviously British, ended staying in England. And that was a very, very long time ago. So I first was doing my surgical rotation in French hospitals, which is in Bristol, southwest of England. And it covers like sort of a big triangle of the M4, M5 corridors. So it's really like a very busy place to do training. And I did that for about 5 years. And then one morning I woke up and said, you know what? I do not want to be a surgeon anymore. I had enough.
Sounds like Jake.
I want to become an interior designer. Can you believe it? But then I was very scared because I thought, what if I'm not successful? What if I pass on this? How am I going to earn money? So I went into general practice part-time, 4 days a week, because I had one day, and actually I really joined an interior designer course in Bristol. So
Wow.
I was doing that for 2 years, and I had a lot of fun. And I was obviously doing my general practice. And then while I was doing all of this, discovered aesthetics by chance because of hyperhidrosis with botulinum and toxin. We were doing training to treat our patients. And then from there, it was like a roller coaster because then I discovered botulinum and toxin for lines and wrinkles. Then dermal fillers, lasers, chemical peels, and it got so exciting. So I said, oh my God, I want to open a clinic. And that's what I did. I decided to open a clinic.
Wow.
My sister said, have you done a business plan? And I was like, what's that? What's the business plan? Don't know. But how many people will come to your door? And, blah, blah, blah. And then I was like, oh my gosh, okay, this is not so easy. So she helped me with the business plan and said, you know what? Because it's 20 years ago, you got a chance. There's not much competition in the area. It's still not that. But of course, it's going to be in a slow business, which she was right. It took about 3 years to probably get very, very established. And then from then on, it's just being a full-on adventure. I loved every minute of it. And yeah, I have a passion for it. And I really, really love it.
Right. So the business plan was inject stuff, get rich.
Well, I don't think you ever get rich injecting. You never get rich injecting. But I suppose it's a lovely career, and I wake up in the morning and I get excited to go to work, which is a good thing.
Awesome.
Who was the first person to teach you? Where did you go on a course? Because we were talking when I last saw you in Jakarta, we were just having a drink around the pool, actually. And many of the people who you grew up with, I'm friends with, like Raj Aquila, Tapan Patel, and all that sort of generation.
They're babies.
Oh, they're after you. Okay.
They're all very young. No, they're only a little bit younger, but they came just only 2 or 3 years afterwards. Actually, Tapan and I met in one of the big conferences in London for first time on the underground, and I have a map in my hand. And I go, oh, how do I get there? And then he saw where I was going. He said, I'm going to the same place. And then we started chatting. And we became quite good friends. And it turned out that he was also friends with a friend of mine because they all went to university together. So Dr. Prima Beck, which is also in London. So yeah, the whole group, we all started at the same time. And funny enough, most of them are successful. So it's very interesting for that decade.
That's really funny because Prima was the medical director of the last clinic that I worked at in the UK before I moved to Australia. So we're all connected somehow.
Yeah.
It's a very incestuous career.
Small world.
Yeah. Do you think you'd enter the industry now if you were sort of starting your career in sort of 2024? Or do you think that, you know, maybe go down the interior design path now? Because as you said, it's a very different space now, right? You can throw a stone in any direction and hit an anesthetic injector in a major city anywhere around the world, basically.
I know. I think now I'm glad that I'm not in interior design. I'm not sure if I have been that good at that. I think what is probably made the difference is obviously I started teaching actually quite a few years ago. The first company I worked for was Johnson & Johnson.
Oh.
And we were doing Evolans, if you remember the bovine collagen back then, which was very unique and true. And it was very difficult to inject. And I did that for about 4 years until Johnson & Johnson closed the books. And then from there, it was a roller coaster. I did training for Radies, then I did training for MERS when they bought Radies. And then I moved to Galderma, which is where I stayed for a very long time. I stayed for about 12 years with them and did the launch of Asalor and Emerbel, which is obviously one of the new Restylane by the Emerbel collection. But back then we only had Emerbel. It was my baby.
Right.
And then got a bit fed up from teaching, left it for a while. And then IBSA grabbed me. And then suddenly I've been working for IBSA now for quite a few years now as well. So by, oh my God, 2016, 17, I'm not sure. It's been a while.
All right.
And then it's been a progressive career with them. And I've been very lucky because they do spend a lot of time in research and scientific papers. So I have been very, very lucky to be involved with all the protocols and launching of new products. And yeah, we have a chance to talk about, of course, the new product Structura has been a massive addition to the portfolio. Yeah, so it's been very, very interesting. So I think it gives a very nice balance to do clinical work and obviously teach, which I love.
So guys, before we get into this episode, part one, which is obviously this one, we're going to go through all the basic science of Profilo, what's in the syringe, what is bio-remodeling, I guess how it differs from different fillers or skin boosters, if you like, what happens on a cellular level. That's, you know, that I guess that defines what the bio-remodeling is. And, you know, what does that mean for our patients? And then in part two, which is for subscribers only to our Patreon, we're going to get into how to best use Profilo. So techniques, wear on the body, face, protocols, doses, and all that good stuff.
Excellent.
Now, it's disclaimer time. This is not a sponsored podcast, even though you are a speaker for IBSA, a global speaker, and I teach for Profilo here in Australia. But this is not sponsored, so we can say what we like about the product.
Yeah. So this conversation is based on your opinions and nothing to do with the opinions of IBSA or all that kind of stuff, right?
No, absolutely. Please, yes. This is going to be just me giving you a little bit of my personal experience because obviously if we do the standard protocols will be very boring and very short talk today.
Yes. Now, we have many listeners all over the world and, you know, some of them don't even have Profilo yet, including the States, which is a big territory. To my knowledge, it might be there in 2026. That's what I last heard. So
that's the rumors. Yes. At the moment, working on the FDA on the approval.
Yes.
So, yeah.
But can you just tell people who IBSA are? Where are they based? What do they make? What do they do? Just to sort of fill that gap in, and then we can get into, I guess, Profilo and bio-remodeling.
Yeah, so IBSA was a starting company from Switzerland. It was a family company, and the guy who founded it was still very much into everything on until about a year ago, and I think now the family is taking over, and they moved some of the manufacturing to Italy. And now they go headquarters in both Switzerland, in Lugano, and in Italy. But they're a pharmaceutical company. So they have always worked in ocular, joints, a lot of things to do with hyaluronic acid. And I think what is very distinctive for them is they actually get the raw material. And then from the raw material, they're very lucky to be able to develop the products. And they have the whole control. So they call it ultra pure hyaluronic acid, which is got patented on it, because as I said, they make it really, really special. And they do play a lot with molecular weights, which again makes it very different to a lot of the other sort of fillers in the market. And of course, they got Profilo, which again is patented and is totally unique again, because it's very different.
Right. And do you define it as a filler or a bio-remodeler or a bio-stimulator? Where does it fit? Because it is an HA, but it's not acting in a traditional way.
It is an HA. So yes, you have the two molecular weights, so a high and a low molecular weight. As we know, when you start playing with molecular weights, it's very important because if you got very, very little molecular weights, so 5, 10 or below, it can be a little bit inflammatory. It's only when we start going around the 100 to 100 something, which is the 80 to 140, you get a little bit of an anti-inflammatory effect. And of course, when you do get anhydration, but if you get a higher molecular weight, which is around 1,000, which is the two they're playing with, then you start getting also wound healing properties. So it's the anti-inflammatory, antioxidant, wound healing. And we do know as well that if it's injected at the right levels, then you get the stimulation of all the type of collagens. So it's the only product in the market you can stimulate collagens 1, 3, 5, 7 plus elastin. So you got the most complete one, and you hydrate the skin at the same time because it's hyaluronic acid with all the anti-inflammatory and etc. So it's the wound healing part, which has been very, very good because it's a lot of research now on a lot of the other properties and options to use this product, like, for example, in psoriasis, in dermatitis, so it's just an endless list, scarring. So it's brilliant. And as I said, very unique, and it's got no chemicals. So it's been stabilized by a heating and cooling process. So it's totally organic. When you get the publications on side effects, up to now, the only thing we can say is maybe a little bit of swelling, a little bit of bruising on the site of injection, but actually there is not really any side or adverse events reported at the moment, which is great as well for us as doctors because it's quite safe and it's easy to use. So very complete.
So why is not having a crosslinker so important? Because, every other filler on the market up until, I think, Profilo, unless obviously like the very thin non-cross-linked skin boosters, Profilo is quite unique. It doesn't have BDDE. So how and why is that important, Beatriz?
That's a really good question. So first, we talk about molecular weights. Yeah. So we had the two different molecular weights, but now let's talk about concentration. When you talk about fillers, most fillers concentration will be between 20 and 25 milligrams per milliliter, because we know as soon as you try to go higher, because of the BDDE, become inflammatory. So actually you cannot really inject it because it causes too much inflammation in the skin. Obviously, skin boosters can go a little bit lower. As we know, some of them have 12, 15 milligrams per milliliter. And then the non-cross-link, of course, that's different because you can go really low because it's not cross-link and it wouldn't matter. So the challenge has always been increasing that concentration. So IBSA has managed, by not having a BDDE, so by not being any chemicals in it, to push that concentration to obviously 65 milligrams per milliliter. So it's really, really high. And it's the first time you have managed to get that with no chemicals. So of course, that means that challenge of increasing the concentration is being managed to break. Now, because there is no cross-linking, the rheological properties are very unique. So you have got a G prime, which is not very high, so very low, 39 only. So that means it's more like a soft, like a bit like a honey or like something very soft like that. However, because the tan delta is above 1, it's actually 1.39, it's actually really soft, which means it's like behaving like a liquid, not like a solid. So suddenly you got a product with two molecular weights, with very high concentration of hyaluronic acids, with no cross-linking, with this very specific rheology, which made it to be able to move in the tissue 3 dimensions. So it's going to expand sideways a little bit, around 2 to 3 centimeters diameter, and also it's going to go upwards and lower. So that means when we inject it on the dermis, on the deep dermis or subdermally, you're going to still go a sort of progression of this product into epidermis, but also into the subdermal fat, and sometimes a little bit deeper, depending on how deep you go. But really, the main focus of Profilo was to inject it on the dermis because it's for elasticity and laxity. So the idea is to produce collagen, hydration, beautiful skin, glowy skin. It's like an anti-aging without changing your shape of your face. So, of course, if you got a product that's going to expand so beautifully like that, and it's going 3-dimensionally to work at all these levels, when it's injected in the extracellular matrix, we do know, of course, that through all these receptors and activation, which is a whole cascade of effect, it's going to create all this collagen and elastin. So, of course, you're going to have, as I said, a beautiful result with no changes on shape or form because it's not cross-linked. So you cannot create volume. So that means you're going to just have a skin quality. So it's actually a proper bio-remodelator. And as we said earlier, because its molecular weight also have the wound healing capacity, the antioxidant effect, and all of these, we're creating a product which is helping the skin to rejuvenate and the dermis to get obviously healthier over time. Which is why it's important that patients understand this is not an immediate result. It's not like when you do your cheekbone or your lip and you get your volume and it's perfect there and it's okay. No, this is going to be an ongoing work, but is, you ask me, the best investment you can ever do to your skin.
Can I ask? So I've always found it a little bit generous when we talk about 64 milligrams and being, a very high molecular weight, because that's in 2 mils. So is it more fair to say it's 32 milligrams per mil?
Per mil.
Right. Okay.
32 milligrams per mil. Yes.
Yeah. Okay. Fair. And so just to summarize again, because there's a lot of information there. You've basically got 2 chains of hyaluronic acid. One's high molecular weight, one's low. And instead of sticking them together with a chemical called BDDE, I've always imagined it like this, but you can tell me if I'm wrong. They basically put them in a pressure cooker and increase the temperature, but also the pressure. And then when they cool it, they're stuck together. So there's no chemical sticking them together. It's the heat that somehow magically stuck them together.
Exactly, because the bonds, when it's been heated and then cooling, those bonds rearrange and they manage to stabilize.
Yes.
And actually, when they did the studies in vitro, they compare it to the gradation when it's injected into the tissue, it was compared to Aliaxin Shape and Restore. I mean, you guys don't have Aliaxin in Australia, but it's like a filler with a cross-link, which is got a low G prime. So it's not very hard. It's a softer filler, which it gets injected in the dermis to improve skin quality. So really, if you compare it to a softer type of filler, which obviously there are few in the market, that's what they compare it to see the degradation in tissue, and it's equivalent to that. So that means it's going to stay there for long enough to do this activation and treatment.
Yeah. And so that kind of key difference, there's no BDDE, but it's now very high concentration but runny. So you inject it in the skin and it sort of spreads like a puddle. That is the key difference. And that is how it works differently, as far as I understand
it. And this is why there is nothing else in the market. I know a lot of brands are trying to compare it or whatever, but you can't. It is impossible because the rheology is so unique and specific. And as I say, it's a patented technology, so no one would be able to ever do it. And I think they discovered it. It was Dr. Beautiful Sharaski. She and her team found it, I'm sure, by chance. I mean, she always makes a joke, like to say, gosh, we were trying different options because we didn't want to use chemicals, and suddenly they came with the winning pot. So it's very interesting.
So it's almost not an accident. They were obviously trying different things, but they were just sort of throwing different recipes together just to see what would work, was my understanding.
Absolutely, yes. Very clever lady, very, very clever.
Right.
So what is the actual mode of action? So you inject it into the skin, and then what is this hyaluronic acid doing, this special formulation of hyaluronic acid? What is it doing to the body to stimulate collagen and elastin? And how does that differ from, say, something like a Sculpture or a Radiesse? And there's a lot of conversation around the quality of the collagen because there's apparently hundreds of different types. It's not just like the ones that we were talking about today. There are some people saying that this is actually scar tissue. It can cause complications later with things like facelifts. So can you just sort of demystify that a little bit for us and explain what is actually happening?
Yes, it's a very complicated subject, but you're right. When you're using things like a Structura or Radiesse, you're getting only really one type of collagen, which is more the fibrotic collagen. So it's more like a reaction to the skin to an injection. So you inject something and the skin reacts to that. And it's the same that when you cut yourself and your body is trying to repair it. So it does create a little bit of a fibrotic collagen. So when we notice, for example, when you inject people with a cannula and they have been for a very long time with this type of procedures, it feels very similar because it's quite like a hard, you feel like a crunchy nearly when you're going through the dermis. It's what happens as well when you have a facelift. They stretch everything and you get scarring tissue in the skin. So again, if you try to inject someone after a facelift, you're going to find a little bit more resistant. Now, with Profilo, you don't get that because you don't get just one type of collagen. You get all the different types of collagen and elastin. And that's the key. And also you're attacking fibroblasts at both levels and keratinocytes. So you're getting all that stimulation of the different keratinocytes and fibroblasts to produce the different types of collagen and the elastin. And as I said, there is a paper actually has been published with Dalby, which I've been part of. And that paper is amazing because you actually really go into the nitty-gritty of all the receptors, the activation and everything in it. So it's actually, as I say, a complex because you're repairing the extracellular matrix. It's like you're giving them the cells the good food to be able to stimulate and repair. So it's really regeneration. We're talking about regenerative medicine. And as I said, the studies we done with wound healing, where you inject after a surgical scar or acne scarring, where there is inflammation, as I said, the psoriasis papers and all of that, is actually showing us that you're getting a proper repair of the skin. So it's not just the beautification, which of course is great and what we use it for mainly, but actually you just start thinking you are getting your skin to look a lot younger. And as I say, it takes a little bit of time. Usually after a few months, you see obviously a difference. But when you look a year later, you go, oh my gosh, was that me a year ago? I look a lot better. My skin looks so much younger. So it's that sort of accumulation effect. And of course, the beauty of all of these treatments, if you stop for a while, doesn't matter either because you don't really lose. I mean, you carry on aging, of course, but you already regenerated. So if you go back to it, it's not an issue either. So it's a great, I think, treatment for younger generations coming. It definitely has transformed the way I work in my own clinic, the way I approach faces. We use fillers now much more cleverly because we use them only when we need a projection, an enhancement for shaping, or something you want to really enhance as a beautification, but in a lot less and in a key place. So actually people look much more natural these days than we did maybe 15 years ago when everyone was pumping up fillers just to lift the skin. So these days we don't need to do so much of that. So it's become much more sophisticated way of injecting.
That's a good point, actually. I mean, I'm assuming that you're saying as well that the trend in the UK is less HA and more bio-remodeling and maybe biostimulation, laser skin and everything being combined, but more judiciously rather than just shoving volume in the face.
Absolutely. I think we've been one of the latest markets on that. I think Europe in general, like if you went to Spain, Italy, France, they've been more natural for a little bit longer than here. But finally, there is a catch up. And everyone now is starting to think more about, I want to look myself. Before people maybe arrive and say, I want this type of lips like this famous person. I want a contouring like this. But now they go, I want to look me. I don't want anyone to notice I'm having anything done, but I just want to look fresh and I want to look well. So I think there is definitely a shift in these trends of how we approach it. And I think it's going to continue. And it's, an evolving way to work now.
If I can wheel you back to bio-remodeling as a process. So, I train for Profilo, and the way they've always shown, they've got this like little cartoon sort of video. These little pieces of the Profilo sort of break off the main strands. They call them the hybrid cooperative complexes, kind of a bit of a tongueful. But basically, these things then stimulate the fibroblasts. Is that correct?
Yes, exactly. So you get into the extracellular matrix and then you get the fibroblast stimulation, and from there is where you get the cascade of effects.
And then what gets a lot of injectors confused is that it doesn't just work on the fibroblast. And you said it before, the Profilo can spread both up and down and sideways. So I think we can all understand, yes, you're making the fibroblasts happy, they're making collagen, they're making elastin, but also then they talk about helping the adipocyte cells. So what exactly does it do on the fat cells?
Absolutely. So because you move, I said earlier, upwards into epidermis with the keratinocytes, but also when it goes downwards, because, it moves a little bit up and down, then you activate the adipocytes. And of course, at the moment, this was the trigger for the new product because we thought, oh my God, we can also stimulate adipocytes. And actually the latest studies, we know now that you can get myocytes as well, and also the bone acceleration. So it's all getting to another level now. As I said, we're really pushing the limits. But at the moment with normal Profilo, traditional Profilo, what we do notice is sometimes, particularly when you inject, the point here on your face, where you go sort of the base of your tear trough, sort of roughly, if you stimulate that on young patients where they got the beginning of the volume loss in that area, you do see a regeneration of that little fat pad.
Right.
Which is very interesting because we were using also fillers all the time before that. And now we are trying to repair it first before we put fillers because it's a much more healthier way and you look better. So yeah, you can work at all these different levels, and it's been proven that from 7 days in vitro, you get an improvement of the fat cells regeneration. So when they're staying on red, they can see the healthy fat cells, getting better, healthier. And by 21 days, you get actually a quite significant improvement. So it's actually faster than we thought, because we thought it would take a long time, but actually it's very quick. So when you see them at a month, you already see an improvement at one treatment. We're talking young patients. Of course, if we got someone in their 60s or 70s, it's going to take a little bit longer because everything is slowing down.
Yeah, interesting. You've had Profilo. Did you notice any volume change? I mean, not that you need it, but...
No, just noticed hydration. But I mean, I'm one of these people that tries everything. So I don't, at the end of the day, actually know what's working. Because
he just takes it away.
I just between skin needling and using vitamin A and energy devices and Profilo and... Yeah,
Sculpture, Botox.
Yeah, I don't know. I'm just hoping that something works.
That combination is always good.
Yes.
No, it's interesting, actually. When I first learned to use Profilo and they started talking about the fat cell stuff, I said to them, and everyone laughed at me in the room, I said, well, has anyone tried injecting the deep fat pads to see what happens over time? And everyone was like, no, it doesn't do anything for volume. You're crazy. You're wasting your Profilo. But maybe. But I don't know. So you're saying that it actually does improve volume, but obviously subtly.
Yes, exactly. I mean, the latest studies have said now we are injecting in the superficial fat pads on the first preliminary things, but we do see an increase on thickness. So Dr. Daniel Casuto published a paper where he injected the preauricular area, and obviously is with a Structura, which is a slightly bigger concentration of HF. It's the same technology. And he's got a 23% increase on thickness of tissue.
Right, interesting.
So, as I said, it's the healthy of the skin. So obviously with traditional Profilo, you could go in the same way, but Profilo degradation will be a little bit faster. So, but you still have to inject a little bit more frequent, but you will create an effect. So it's worked. We were starting to use it already off label on areas where we thought we want to repair a little bit of this fat, so go a little bit deeper, just to get the bigger stimulation at that level. And of course, incidentally, still will go into dermis and create, obviously, acceleration of the other cells at level of the dermis. But so you can play at different levels with it, which is obviously the more advanced way of injecting Profilo. And yeah, for the ones of you who still haven't got the new product in, why not? I would. I mean, it works. So...
There you go. You heard it first.
Yeah.
Can you give us any sort of research data about how much collagen it's making or how much elastin it's making? How long does that process take? Because a lot of the studies that Profilo quote in their teaching, it's in vitro, it's not in vivo. So I don't know if you can give us anything just to sort of hang our hat on.
It's very hard to do in vivo, isn't it? Because you will have to do biopsies and people will not be very happy to be biopsy on the face. So it's difficult, and you're right, all the papers are in vitro. And I think most of the accountability is because we see patients day to day and we follow them up over time. We do a lot of 3D imaging so we do a full screen of normal photos, videos, 3D imaging for our patients so we can actually look at the skin. We even like to take a video pinching the skin to see, the elasticity and hydration and how the quality is, because you forget how you look. And what is very interesting, for example, this week I had a patient who has been on just Profilo and toxin for 6 years. And I thought, well, let's pull you photos. And we had a 3/4 image 6 years ago, smiling a little bit, no smiling and smiling. But when she was smiling, you could see all the wrinkles on the face here, all the way down. And the skin quality was just no good. And it's just the photo, because back then we didn't have the 3D. And we took a picture, same position, same lighting. I thought, I'm going to try to be as equal as I can. Oh my gosh. You can really see the quality of the skin. And she's 6 years older.
Yeah.
And she looks incredible. So how much? I would say then it's hard to measure it in quantity, but I would definitely say that if you have had it for a year, in my opinion, you at least take 5 years of your skin quality, at least.
Right. Okay. So how long does the HA actually last in the skin? Because it's uncross-linked, so I'm assuming the body mops it up and gets rid of it pretty quickly. So what's the process after it's injected? And then I'm assuming as it's breaking down, you're getting this stimulation process happening. Is that what's actually happening? Is it the breakdown, or is it just its presence in general terms?
You are right, because you get enzymatic degradation, and obviously it's getting attacked as soon as it gets injected. So their thinking is probably around maximum 6 weeks, more or less. But it could be 8 weeks, depending, 6 to 8 weeks. And while you do the maximum effect, I suppose you get for hydration is the first few weeks. And after that, obviously, you can see the rest happening because, as I said earlier, with the adipocytes, it's about 3 weeks. The same with collagen. So from 3 to 4 weeks, you start getting the tightening effect. And they suggest, obviously, the repetition of the treatment because, of course, you want to continue this for a little bit longer. That's the whole idea. So you do for at least 4 months. When you do 2 treatments, you will think 6 to 8 weeks, 6 to 8 weeks. So about 4 months. And that's when you see your peak. And at this point, you review the patient. And again, depending on lifestyle, quality of the skin, age, etc., then you may decide to repeat at 4 months. Otherwise, you could leave it for 6 weeks, for 6 months. So we say 4 to 6 months maintenance. I would say if you're 50 plus, it makes sense to do 3 times a year. If you are younger, twice a year is sufficient. So patients, at least until mid-40s, if they've got good skin, twice a year is enough. From then on, we'll see, depending on your lifestyle.
Yeah, I can't remember the name of the gentleman. He's the R&D guy at IBSA. He was there in Jakarta with us, and I asked him that exact question, and he said it's hard to say, but he thinks between 4 and 8 weeks that the Profilo is gone.
Yes.
You know, because patients are getting really worried about all these MRI images of, you know, faces stuffed with filler, and I think Profilo is very, very different in that sense. So, you know, if you have patients who are a bit nervous of filler, it's a great sort of starting point because, you know, you can almost say to them, well, it's going to be gone in about 2 months and it's going to be super subtle.
Absolutely. I think maximum is 2 months. Sometimes it's quicker. And of course, like you say, because you've got no chemicals, you're not going to have any reaction. It's not going to go anywhere. It's going to stay literally on your skin. And all the process of activation is just literally on the skin. So I don't know. It's for people that worry will be a really good starting point because, as I said, it's a very simple procedure. Doesn't have really downtime, and you get a rejuvenation without having to add any chemicals to your body. So it's totally natural product, isn't it?
Yeah. You sort of described the difference between bio-remodeling, or I guess the mechanism of Profilo, and the difference between, say, Structura and Radiesse. And I think you said you launched Radiesse many years ago. So when would you choose to biostimulate someone versus bio-remodel them? Like, why practically would you choose to make those two differences?
Up to Profilo, yes, I will use a biostimulator because we only have fillers. And when Radiesse came, was so unique and so different to HA fillers and a good alternative. To start with, though, we were working on it because of G prime as a filler. That was the first use of Radiesse for the first few years. They didn't quite understand the rest. So it was more like super periosteum, and the license was pretty much for zygomatic and jawline. And pretty much that was it. You were not allowed in teardrops at the beginning, or temples, or foreheads. Then we started pushing into temples, preauricular area, because we realized that if we went in the dermis, we got more tightening. And from then on, but because of the calcium hydroxyapatite and the way the particles can stay for many, many years on the skin, which is why people started worrying, that's when the dilutions came into place and they started playing with the product in a very different way. And it's only been the last few years. For me now, there is no room for anything which is I cannot dissolve. I want to have products in my clinic. If I have a complications, we all know complications can happen even in the hands of the best injectors. So if a complication happened, I want to be able to handle it and dissolve it. So for me now, I'm so sorry, Radiesse. I used to love you loads, but now there's no room in my clinic for you or for a Structura.
Fair enough. If the listeners didn't know, we did an episode, 4 or 5 episodes with Kate Goldie on Radies and how she uses it for biostimulation and rejuvenation. So listen to that one if you wanted to.
Well, that's the thing, isn't it? That's the beauty of these discussions, is you're going to have people from different parts of the world with different things they're willing to do, different strategies. And so I guess, that's the purpose of the discussion.
Absolutely. 50 Shades of Grey.
Absolutely. Now, I guess last question of part 1 is, we're talking about skin quality, and you've said that you trained in laser, etc. So apart from injectables, like, how do you then combine Profilo to really optimize your patient's skin? And of course, it depends on indication and age and so on. But do you have any particular protocols where you say to your patients, look, here's your injectable sort of treatments, and here are your energy-based, and this is your topical? Do you sort of build them all into a combination for your patients?
Oh, absolutely. And I think when you got patients that are a little bit more mature and they haven't had treatments before and they've got a little bit more of a rush to get there, it's good to put a little plan for them. So we love high intensity focus ultrasound because I think HIFU, again, give you all the different types of collagen production. So obviously you have to get to 60 degrees, as you know, to get proper neocollagenesis. So it's quite hard with radiofrequency to get there, and you need more treatment. So this is why HIFU gives you maybe on a one-off a really good induction to that. So we tend to do that first. And then most patients had enough after HIFU because, as you know, it's quite uncomfortable. So they want to have a little break and they feel a little bit uncomfortable for a couple of weeks. So then we say 2 to 4 weeks afterwards, you come in and we start on Profilo. Then we do Profilo, and then 4 weeks, the other Profilo. And of course, meantime, we always do a skin analysis and we try to suggest a very good skin care because, of course, that's part of your maintenance at home and to help, the quality. And I do love, obviously, stem cells for also as part of your daily cream routine. I think now stem cells are moving again a long way, and they really do, they do work quite well for skin quality in combination with your obviously vitamin C and retinoids, etc., alpha, beta, ascorbic acids, and we know all of the rest. But so a little program like that, and it's mainly for lower face and neck. That's what we find is the hardest to maybe, and particularly, you get the jawline definition and that sagginess on the neck. Profilo works well on laxity, but when you got a lot of weight in there, you do need extra help. And so, that's a really good one. I think that's the most the quicker to really get there. But also we loved something called PRST33, which is beautiful because it's a TCA combined with hydroxy peroxide on a low molecular weight, which has got obviously a healing effect. So rather than a TCA, when it goes through the skin, you get all that burning of the surface of the skin and you get the peeling and all the horrible look. This one, because it's being mixed with this hydroxy peroxide at low molecular weight, it makes it not being caustic. So when it goes through the skin, it's not burning, but you still get all the beneficial effect on the deep dermis. So it was beautiful for skin quality for people that want a more slow progression, and it really mixed very well with Profilo. And with that one, you do need 4 to 6 sessions, but then we combine it with Profilo either on the same day or separate sessions, and then you get a really beautiful activation with no downtime, which is very nice.
Heard of that product before.
Never heard of it. Is it compounded, or where's it from?
It's actually from an Italian company. We have had it in the clinic for about 8 to 10 years now.
Right.
So maybe, it will be worth to check why you haven't got it there, because it's honestly absolutely gorgeous and it's easy to use. Our therapists will do that. It's applied topically because it penetrates the skin. So you apply in the skin, like if it's a facial, penetrates, soaks in, and 15, 20 minutes, treatment done. And very nice results with no downtime.
Interesting.
Oh, well, after hearing this, someone's going to reach out for the distribution rights, I'm sure. So.
Yes, please do.
What are your thoughts on laser or even RF microneedling or even skin needling with Profilo? Like, when should people stagger that, and when's safe or when's not safe?
I think when you go to more invasive procedures like this, if you got someone with extremely thick, damaged skin, like that leathery, thick skin, then we tend to use the radiofrequency with needles to obviously you sort of contact the skin. So you penetrate in the energy. Still, you're only going 2 to 3 millimeters in depth, but you are also resurfacing a little bit because you're burning a little bit with that radiofrequency. But you do have downtime. You have to be careful with the skin types 4+ because of the inflammatory pigmentation. In the UK, where, majority of patients are skin type 2 or 3, but of course, if you got Mediterranean skin like mine, or Indian skin with a 5, then you have to really, really be careful with it. So, which is why maybe it's more limits to it.
Yeah.
And again, that's why PRS is brilliant, because you can go in the sun and you can use it with any skin types. With normally traditional peelings, again, you have to be careful with the skin types 4+.
Right. I was asking because a lot of people worry that they're going to melt the Profilo with the energy device because it's in it's in the dermis.
No. It's about timing. So first you do your energy device, you cool the skin for 5-10 minutes. Usually it cools very quickly because, as you know, with radio frequency, maybe if you're lucky, you get to 43 degrees. Otherwise, it's too painful and you can't tolerate it.
Yeah.
So it cools down very fast and you can straight after do it if you wish. And because you don't need to repeat very frequently, 6 weeks in between.
Yeah.
You could wait. Then I push my Profilo for 6 weeks in this case, and then they come back and they have a second session together. And to be honest, when you do this type of macroneedling, you only need 2 or 3 sessions. You don't need many because it is very aggressive. And we're talking, but as I said, it will only be left for these people with extremely thick leathery skin when I think, what else can I do to get that lovely skin to get quicker into place?
Yeah. I guess just finally, before we finish this episode, for maybe Americans listening or someone who already has skin boosters,
yes.
What is the effect that's different about Profilo versus, say, a traditional skin booster?
A skin booster is a beautiful product for that superficial part of the dermis. So you're getting more that superficial hydration, and you are going to get a little bit of skin quality, a little bit of collagen production again, but only a couple of types of collagen. But because skin boosters normally, you mainly for hydration and glow of the skin. So it's more superficial. You're not getting that deeper reparation at, to another level. So in that case, I will use definitely HIFU or radio frequency, mainly HIFU because you can go all the way deep. And then you could use the skin boosters for that surface skin and play very, very cleverly on how you stretch that superficial dermis. But yes, you're not getting as much because the concentrations, most skin boosters are 12, 15, maybe 18 milligrams. You can push it, but majority, you have to be careful with also some of them. If you got Nasha, for example, you may get volume with it. So you have to be a little bit more careful how you inject it so you don't get the papules or the side effects from it. But if you inject it cleverly, and of course, Nasha, we know, again, we're going back into a different thing with fillers now, but integration in tissue is not so good, but you attract water. So there is obviously another skin boosters, which I would prefer. Again, you're not sure if you got it you got Viscodem Hydro Booster from IBSA?
No, it's in New Zealand, but we are waiting to get it in Australia.
The license. So hopefully you get it soon because you get 4 times more hydration absorption because of it doesn't have the rheology. So you don't have the G prime, which you got with Nasha, but you get tissue integration, which is part of this molecular weight playing a game from the IBSA technology. As I said, they play with the molecular weights a lot to get beautiful tissue integration in tissue, which you don't get with majority of them. But it's a very nice product for that superficial.
Brilliant. Well, that ends part 1. And if I can whet your appetites for part 2, we're going to get all into, I guess, which patients are the best for Profilo and who makes the best candidates. I guess who doesn't make good candidates. That's important as well. How to consult for Profilo, treatment protocols, dosing areas, reviewing on-label techniques as well as off-label techniques. And then we're also going to talk about new indications which are on-label in some countries, including forehead and temple Profilo, which is interesting. And then we might talk a little bit about Profilo body, and then finally we'll tease you about Structura. So hopefully you can join us in part 2, guys. But thank you, Beatriz. We appreciate your time, and we'll see you in part 2.
See you later.
Very much for having me.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.